So the best way to fight depression without drugs and without the use of prescription medications is to work on changing the underlying psychological habit that creates your depression. Perhaps the most common underlying psychological habit is that of rumination. This describes patterns of habitual reactive thinking that tend to proliferate in the mind and that feed the underlying depression. Thoughts do not cause depression, but they do feed that depression underneath. One of the best ways to control rumination is by learning some form of mindfulness meditation practice, particularly where we practice on meditating on the mind itself. Meditating on breathing is a common mindfulness practice that is a very good relaxation exercise. But what really makes the difference is when you start meditating on the mind. This allows you to start developing more conscious awareness of these patterns of habitual reactive thinking that feed your depression. When you become more aware of them, you can begin to break free from the rumination. We practice many different mindfulness techniques to help you with this during the online therapy sessions that I teach for managing depression and also anxiety. One of the most effective approaches is called the placement technique. And this is where you learn to greet your thoughts consciously and also in a friendly manner, and then move those thoughts to a lower level, such as placing them on the floor. This is an interesting exercise to try. Most people have never thought to do this, but the position of your thoughts in the mind, the way you see them, is a very important factor in creating the depression. Usually the thoughts are too close and too high. That's how we see them, and it's that closeness that becomes menacing, if you like a swarm of bees. If you space those thoughts out, create more space around them by moving them, that takes away that menacing quality, the crowding effect of too little space, and that can have a dramatic effect on decreasing the intensity of the emotional stress produced by those ruminating thoughts. So you might try practicing this yourself. If you'd like to learn in more detail how to apply this technique, the placement technique, and other mindfulness methods for managing rumination, then simply go to my website and email me, and let's set up a trial Skype therapy session to help you overcome your depression. It's not always necessary to take medications, and in fact medications generally can only relieve symptoms unless there is an underlying medical condition. But for most people that's not the case. It's simply that they have developed habitual patterns of rumination that feed the depression. So go to my website, learn more about mindfulness therapy for depression and anxiety, and if you'd like to schedule a session, simply email me and we can arrange a time that works for you and for me. Thank you.